Hi, my name is Julia, and this is Disorganized Mind. I am a clinical social worker and a mental health therapist. I am here to help you be mentally healthy and happy by teaching you about your disorganized mind, including the different mental health diagnoses, coping skills, and answering your questions about mental health, therapy, and ways to manage difficult situations. We are going to start by learning about mental health and emotions. We as humans try to be as healthy as we can. We try to eat right, exercise, and get plenty of sleep. We also go to the doctor for checkups or when we get sick. When we are doing all of these things and are thinking about health, we are thinking in terms of our body or physical health. But really, being healthy means more than that. It also includes what we think and how we feel. This is called mental health. When you get blood drawn and they test your iron levels, they determine if you need any sort of treatment by measuring how much iron they find in your sample and compare that number to a range of numbers they consider normal. It is a range because everyone is different. If your number is higher or lower than their range of normal numbers, then they say you may be sick and need treatment. The idea of normal or typical is important for mental health professionals too. Although, because everyone is different, it's not helpful for us to define ourselves in terms of normal. Merriam Webster Dictionary defines normal as conforming to a type, standard, or regular pattern characterized by that which is considered usual, typical, or routine, within a range considered safe, healthy, or optimal. People typically don't try to see a mental health professional like a therapist, psychologist, or psychiatrist unless they are experiencing something unusual and uncomfortable. We call these symptoms. When you go see a mental health professional, they get as much information as possible about your history, relationships, family, physical health and medications, faith, and your day to day life in order to determine if what you are experiencing is unusual or abnormal for you and the culture you live in. They do this in order to be able to help you feel better. It is always important to be honest when answering a mental health professional's questions. There is nothing to be embarrassed about. There is nothing they haven't heard, and nothing that will shock them. But mental health isn't something we should only pay attention to when we have problems. We need to pay attention to it every day so we can avoid having problems and be able to identify when we do have them. We do this by listening and understanding our emotions. Emotions are feelings. When we feel happy, sad, angry, hurt, overjoyed, jealous, etc., we are experiencing emotions. We never feel without thinking, but most of the time, what we are thinking isn't obvious to us. So it feels like we feel without thinking. Thinking can also change the way we feel, but that's a topic for later. When you get a gift, you feel what? Happy. When you lose a friend, you feel sad. We feel automatically. And our feelings can tell us things that we don't already know sometimes. A simple example is our feelings when listening to music. Say you're on your way to somewhere great and you start to feel sad. You get confused as to why you're feeling this way. Then you notice the song playing on the radio. The last time you heard it was on a sad occasion, maybe at a funeral. You realize you were feeling sad because the song came on and you were reminded of the person you lost. This is an example of your brain noticing something in your environment and triggering an emotional reaction, all without you noticing. When our brain does something that we don't notice, It's called an unconscious process. Our brains accomplish unconscious processes all the time, like breathing, telling your stomach when and how to digest your food, and sometimes how to feel when a song comes on the radio. So, how does knowing this keep me mentally healthy? Well, if you have a strong emotion about something, that's usually a clue that you should pay attention to it. If you feel sad, scared, and angry when your mother's phone number shows up on caller ID and you know you have to answer, maybe those emotions are telling you something. Maybe they're telling you it's a bad relationship and you need to work on the way you cope with talking to her. Maybe the relationship needs work, or maybe she's emotionally abusive and you need to work on protecting yourself when you have to talk to her, or not talk to her at all. Emotions are clues to help us understand ourselves better. Listening to and managing our emotions help us to be mentally healthy and happy. If you liked this video and want to learn more about mental health and how to keep yourself healthy and happy, hit the subscribe button. Email any questions or comments to disorganized.mind.licsw@gmail.com. Stay healthy and happy.